Hey, how's it going, everyone? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 9 of my multi part video series giving a broad overview of the discipline of anatomy for these exams. So, without further ado, let's go ahead and get started on today's content. Today I'd like to open up talking about the knee-jerk reflex. The knee-jerk reflex, also known as the patellar reflex, is examined by striking the patellar ligament using a reflex hammer to provoke extension at the knee joint. Both the sensory, afferent, and motor, efferent pathways of this reflex arc are within the femoral nerve, L2 to L4. This reflex test specifically evaluates the function of spinal nerves L2, L4. Moving on. Ankle joint injury, ankle sprains. Ankle sprains stand as the prevailing form of ankle injuries. Typically, a sprained ankle arises from an inversion incident entailing the twisting of the foot, bearing weight in a plantar flexed position. The primary injury occurs to the lateral ligament, specifically the anterior talofibular ligament, given its comparative weakness against the medial ligament. In cases of severe sprains, there may be a fracture of the lateral malleolus of the fibula. Okay, so one quick tip I'll give you guys about the anterior talofibular ligament. A good way to remember it is always tears first, ATF. If you see inversion, sprain, it's probably the anterior talofibular ligament, always tears first. Moving on. Next, we have Pott's fracture, which are fracture dislocations occurring at the ankle, commonly referred to as Pott's fracture. They result from forced eversion, abduction of the foot. This action can lead to the avulsion of the medial ligament, causing a fracture of the medial malleolus, or the ligament itself may tear with a fracture of the fibula occurring at a higher level. Forced inversion, adduction, can cause avulsion of the lateral malleolus of the fibula or tear the lateral ligament. Let's go ahead and move on. So, you know the deal. We have some questions. A 45-year-old male presents to the clinic for a routine physical examination. During the examination, the physician tests the patient reflex. When tapping the patellar ligament with a reflex hammer, the physician observes extension at the knee joint. Which of the following nerves is primarily involved in mediating this reflex? Pretty first order question, pretty recall based question. So if you need more time, go ahead and pause the video. If not, I feel like the majority of you guys should have the answer by now. So moving on now. The knee jerk reflex, also known as the patellar reflex, involves tapping the patellar ligament with a reflex hammer to elicit extension at the knee joint. Both the sensory, afferent, and motor, efferent pathways of this reflex arc are primarily within the femoral nerve, L2, L4. Therefore, damage to the femoral nerve would affect the knee jerk reflex. Therefore, the correct answer is C, femoral nerve. Let's go ahead and see why the other answer choices are incorrect. Radial nerve, C5 to C8, innervates the muscles of the posterior compartment of the arm and is not involved in the knee jerk reflex. Sciatic nerve, L4 to S3, primarily innervates the muscles of the posterior thigh and lower leg and is not directly involved in the knee jerk reflex. Obturator nerve, L2 to L4, primarily innervates the adductor muscles of the thigh and is not involved in the knee jerk reflex. Tibial nerve, L4 to S3, innervates the muscles of the posterior leg and foot and is not directly involved in the knee jerk reflex. Moving on to the next question. We have a 30-year-old female that presents to the emergency department with complaints of ankle pain following a recent fall. Physical examination reveals swelling and tenderness over the lateral aspect of the ankle. She reports that her foot was twisted inward at the time of injury. Which of the following ligaments is most likely injured in this patient? Pretty first order questions, so I'm going to go ahead and move on now. If you need more time, please feel free to pause the video. If not, moving on now. Ankle sprains often resulting from inversion injuries where the foot is twisted inward commonly involves the anterior talofibular ligament. This ligament is located on the lateral aspect of the ankle and is frequently injured due to its relative weakness compared to the medial ligaments. Therefore, the correct answer is B, anterior talofibular ligament, also known as the always tears first ligament. Moving on to see why the other answer choices are incorrect. The deltoid ligament is located on the medial aspect of the ankle and is more commonly injured in eversion injuries. It stabilizes the medial aspect of the ankle joint. Posterior talofibular ligament is less frequently injured in the ankle sprains as it provides stability to the posterior aspect of the ankle joint. Calcaneofibular ligament is also located on the lateral aspect of the ankle joint but is less commonly injured in inversion injuries compared to the anterior talofibular ligament. Anterior tibiofibular ligament is not typically involved in ankle sprains. It stabilizes the distal tibiofibular joint. Moving on to the next question. A 40-year-old male presents to the emergency department after sustaining an ankle injury while playing soccer. He reports feeling a sudden twisting of his foot during the game. Physical examination reveals tenderness and swelling over the lateral aspect of the ankle. X-rays confirm a fracture involving the lateral malleolus. Which of the following mechanisms of injury is most consistent with the described fracture pattern? All right, I think I gave you guys enough time here. I'm going to be moving on now, so if you need more time, please feel free to pause the video. Moving on now. The described fracture pattern involving the lateral malleolus is consistent with a Pott's fracture, which typically occurs due to forced inversion, adduction of the foot. In this mechanism, the lateral ligaments are stretched or torn, leading to avulsion of the lateral malleolus or fracture of the fibula at a higher level. Therefore, the correct answer is D, forced inversion, adduction of the foot. Let's go ahead and see why the other answer choices are incorrect. Forced dorsiflexion of the foot is more commonly associated with fractures involving the tibia or fibula shaft rather than the malleoli. Forced plantar flexion of the foot is more likely to result in fractures of the posterior malleolus or the calcaneus rather than the lateral malleolus. Forced eversion, abduction of the foot can result in injuries to the deltoid ligament or fractures of the medial malleolus, not typically involving the lateral malleolus. Direct impact to the anterior aspect of the ankle may lead to fractures of the anterior processes of the calcaneus or the talus rather than the lateral malleolus. Not processes, just process. My bad for the mispronunciation there. But that will do it all for this video, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, this is FixerMed signing off. Be sure to leave a like and subscribe if this video helped you out. Otherwise, goodbye and good luck studying, guys.